you. So, briefly, just to give a little bit of background about myself, I am a radiologist, diagnostic radiologist, previously trained at the University of California and practicing in Monaco for the last over 20 years. And probably you're all a bit confused because this is an anti-aging conference and you're looking at me thinking, what is a radiologist doing talking about anti-aging? In fact, you probably noticed on Dr. Klatt's pie chart, I didn't yet make the grade. There were no radiologists there yet, but I hope to change that in the future. How does this work, actually? How do we... Which one? How do we advance the slides? Left-hand mouse button. There we are. Thank you. You see, even radiologists can learn how to do these things. So what I've done in Monaco is practice radiology for over 20 years, but I've taken a bit of a different twist, and for the next half hour I would like to demonstrate that to you with respect to total body scanning with a goal of preventively and non-invasively examining the body, trying to find various diseases, and then try to change the outcome of one's health. Now, the way we do a total body scan, first of all, it may be quite an imposing effort to most of you. It actually takes less than 1 hour in and out the door of our institute, Monte Carlo Life Check. The way we do this is to use two different scanning devices, two scanning systems. One is an MRI scanner, a state-of-the-art 1.5 Tesla scanning system. We also use a 64-slice CT scanner, also state-of-the-art. This is very important because a lot of the three-dimensional techniques that I'm going to show you in the next half hour are based upon having the highest resolution scanning techniques. It's also based upon having very fast scanning technologies, and of course with an eye toward low-dose scanning, because of course we don't want to preventively scan the body looking for disease while overly irradiating the body. We do this scan in the method that's depicted on the screen. The brain, carotid arteries, and the pelvis are scanned with the MRI scanner, obviously avoiding pelvic irradiation with the other scanning machine, which is the 64-slice CT, which we use for the thorax and abdomen and inclusive of the spine at the same time. For select individuals who choose to do so, in addition to that protocol, we do breast MRI scanning, breast MRI mammography, which requires an intravenous injection of a very safe contrast agent called gadolinium. We also do CT coronary angiography for those people whom the scan may be indicated, that is, for those in whom we do find plaque lesions within the coronary arteries and who may have an additional set of high risk factors for coronary artery disease and positive family history as well. And for all individuals, we also do a comprehensive blood analysis. Now, we produce stunning images of the body, but our pretty picture is actually what this is all about. Not really. We can produce very different types of contrast and color and enhancement of all the scans you see on the left and right. These are total body scans from two typical patients that came to us. And we can do a very detailed analysis of all of the organs, particularly the most important organs that we deem necessary, that is the heart, the lungs, the colon, the prostate gland, the ovaries, the uterus, pancreas, and so forth. But why do we scan the whole body in asymptomatic individuals? These are individuals who come to us telling us that they feel fine. They may or may not, but they tell us that they feel fine. I just want a checkup. And that's what our goal is, to provide a complete, comprehensive checkup to individuals to detect diseases that they probably don't know about or that they say they don't know about. Why do we do this? We do this because most of the diseases that are fatal and easily preventable and treatable in our society today, namely arteriosclerosis of the arteries and cancer, are in fact detectable at a very early stage and nearly all of them have a very early silent course whereby they develop in an insidious fashion, and we can find them at this level before they become manifest clinically and before it becomes perhaps too late to initiate therapy. As everyone knows, and I don't have to say this, prevention is certainly much more cost-effective than the alternative. Once we can manage to detect these diseases early, we can initiate treatment, and we can also use this scanning technology to follow up the diseases in a non-invasive fashion to determine, one, whether the disease treatment that we initiate is effective, and two, whether we have to modify that treatment in order to try to get better control of it. Aging and degeneration. I mentioned that the major organs that we are concerned with, and that for which I will show most of the discussion today, is the cardiovascular system. That's the disease that kills most people in the world today. It's the disease that's going to kill most people in this room by far. And that does not affect only men. One of the most misleading statistics is that women are going to die from breast cancer or other types of cancer, but cardiovascular disease is indeed the leading cause of death for women as well. Other organs I will also show you today include, as I mentioned earlier, organs such as the lungs, the colon. Colon cancer, for those who don't know, is the second most common cause of death by cancer in our society today. It's a very important organ, and there are ways to detect polyps which may become cancer in an early non-invasive fashion in this organ. And there are other organs that go beyond the scope of today's talk, such as articular cartilage, spine, discs, and neurodegenerative diseases that I won't touch upon. Just know that in this total body scanning procedure, all of these organs are indeed examined. We use General Electric healthcare equipment. I use that equipment because I have been using it for the last 25 years. I have a very close relationship with them. I think there are certainly other vendors that make equipment that's just as good, but this is what we use in Monaco. We use a General Electric 64-slice light speed system. All patients that come for a total body checkup are non-enhanced scans. These are non-invasive studies. We do not inject any contrast unless we have to go further and look into the coronary arteries, and of course that does require intravenous injection. Patient preparation is virtually nil. We like them to come in fasting so that we have a good look at the stomach and proximal intestine, and other than that, no other preparation is specifically required. We use a General Electric 1.5 Tesla high-resolution MRI scanning system as well. We also use a device called an Advantage Windows platform, which allows us to post-process all of these CT and MR images to best advantage to get the best view and contrast, particularly with three-dimensional scans. This is a photograph of our scanning device. One of the biggest problems that some of you may be thinking about is, well, some people just don't like to go into scanning systems, particularly MRI scanners. Magnet technology has improved. The scanning diameters are slightly bigger than before. Large open systems do exist today that are completely not passable for claustrophobic patients. We use a closed system with short magnet technology, so it's virtually unheard of today that claustrophobic patients can't go into the scanner. This is a 64-slice CT system, which is very short and very open, for which the claustrophobic rate is 0. So at Monte Carlo Life Check, we do, as I mentioned, preventive scans. I don't actually focus at all, as I did previously, on routine single scanning procedures for symptomatic patients, although we could do that. Since 2003, this was founded expressly for the goal of doing preventive scanning. The primary focus, as I mentioned, is the most important disease that we see in our office today, cardiovascular disease, and namely coronary artery disease. We do a non-invasive scan of the coronary arteries. We find the plaques non-invasively. We can quantify them, measure them, determine where they are, add these to the various risk factors such as dyslipidemia, blood pressure, family history, etc.